Hello, I'm Dr. Russo, and we're going to talk today about our school, Aesthetic Mentor, and we're going to talk a little bit about one of the biggest problems nurses have faced, and one of the questions I get all the time is, how far can I go with my treatments? How do I know when I can just use neurotoxin fillers, maybe some energy-based treatments, and when should I refer them to a surgeon? Because, that may be what the patient needs. Well, I think it starts with a very honest discussion with the patient, and one of the things I almost always ask the patient is how much improvement are you looking for? Because if someone goes like this with their hands and pulls their face really tight, I'm not going to really be talking to them about neurotoxins and fillers. I'm probably going to go straight to a discussion about surgery. If people start off by saying, well, I don't really want surgery, but then I probably am going to have a discussion about neurotoxin fillers and energy-based treatments. And I have to describe that to them. They say, the reason I'm asking you this question is because, what you just did with your hands, I can't do with anything except surgery. So if you're looking for that kind of improvement, then we have to talk surgical talk. Whereas the other person, we can talk about it, and I say, well, you have to understand that without surgery, you can't have a surgical result, just so you know that. But you can certainly get improvement with fillers and neurotoxins and energy-based treatments, but you have to understand the limitations of those procedures. And you, as a provider, have to understand that as well. How much can you do for that patient? And I've seen plenty, actually more patients than I really care to think about or even talk about, who've gone places like for cool sculpting or for body tightening or for fat reduction, and they were inappropriate candidates for that treatment because they had too much skin laxity, too much fat, too little fat, whatever the situation was. They were not candidates for that procedure. So stay in your lane, understand the limitations of what you can provide to the patient, because the last thing you want is an unhappy patient, because an unhappy patient really will be trouble for you, and they'll tell other people. There's this old saying, like, you treat a patient and they're really happy and they tell like 10 of their friends, and you treat a patient and they're unhappy, they don't like you, they tell 40 of their friends. They really go out of their way to destroy you or to make you look bad, and that's a terrible thing. So in this business, it's better to under promise and over deliver. You hang a little grape and sort of say, hey, I don't know if we can get this, we'll try, maybe 2 treatments, whatever. Under promise and over deliver, but really understand the limitations of what you're doing. Because if you're trying to do a facelift type of result with energy-based treatments and fillers, you're going to be sadly disappointed, and your patient will be as well. So just remember, stay in your lane, but really understand the limitations of what you're doing, and explain to your patients. Have a really good conversation with them about what their level of expectation is. And don't be afraid of losing that patient. So for example, nurses are always thinking like, oh my God, what if I send the patient to you for facelift or neck lift or blepharoplasty, rhinoplasty, whatever it is? I know you do neurotoxin and fillers, I know you do this and that. Am I going to lose that patient? Absolutely not. We make it very clear, and I think most people do. We make it very clear that you're just here for the surgical part. We want you to go back to your provider and do all the stuff that you do. But from your perspective, you need to prepare the patient for that. So if a patient is going to have a procedure, prepare their skin, sell them some skincare products, do some pre-treatment with radio frequency, get their skin tighter, talk to them about, as soon as the procedure's over, come back to you for some additional treatments, PRP, skincare, whatever it is that you have, based upon what the patient's having. So kind of be involved with that care, and the patient will come back to you. But the number one thing that people come back for is outcomes, right? So if patients come to you and they get a good outcome, and they're treated well, and you're pleasant to them, they pretty much will always come back. However, if you don't get good outcomes, if the patients feel like you'd sold them a bill of goods, that they were going to have a beautifully tight neck and they didn't, that's a problem. So understand that and embrace it. You can always do more, but make sure you understand what your limits are and be very honest with the patient. And if they are a surgical candidate, send them to the surgeon and then take them back when they're ready. So subscribe to us on YouTube, follow us on Instagram, and if you're a nurse looking to get started in this profession, click on the link down below and learn more about us at Aesthetic Mentor.